Are robots ready to take over the world? But today, let's talk about AI can actually save lives and help healthcare for millions of patients around the world. Hello, everyone. I am your new host, Sahar Hussain, and welcome to the third episode of AppTalk by AppVerticals, where we share industry insights and have conversation with industry leaders. The conversation is not only about AI, but we are going to discuss what happens when AI meets medicine. As a guest, I have a person who is on the front lines of healthcare for years, and now he's exploring AI in medicine, the author of ChatGPT MD, and the person who is exploring AI and medicine now is bridging the gap between doctors and technology. So, without wasting time, let's meet Dr. Robert Bird. Hello, Robert. How are you? Welcome to the podcast.
It's a pleasure to be here. All is well on my end.
Great. So I was looking forward to this podcast, and I'm really excited to have conversation with you on healthcare industry. And we have co-host Zed along with us. Zed, can you please introduce yourself for the audience who are not following us from our previous episodes?
Yeah, I'm here as a product manager at AppVerticals, and I'm specifically working on some of the healthcare projects. So, yeah, I will be filling in, asking some insightful questions from Dr. Robert to learn more about the industry.
Looking forward to it. Nice to meet you.
Perfect. So, Robert, can you introduce yourself? Who is Robert? Your hobbies and all?
I am a physician. I've been the CEO of Kaiser Permanente, responsible for the healthcare of almost 12 million people. And currently, I teach at the Stanford Graduate School of Business and the Stanford Medical School. I write for Forbes. I host my own podcast called Fixing Healthcare. And anyone who wants any more information can find it at robertpearlmd.com.
Oh, that's great. So you have been in healthcare industry for so long, right?
My entire career, I went to medical school at Yale, did my residency at Stanford. And ever since then, I've been to Kaiser Permanente.
Amazing, amazing. So, what is the major difference you see? Like, if I say 5 years ago healthcare and now healthcare?
The biggest change, I believe, has been the introduction of generative AI. So far, the tool has been used predominantly for administrative tasks, although it's also being used by clinicians for what's called ambient listening, so that rather than the physician having to stare at the computer screen, the individual can look at the patient while the generative AI tool listens into the conversation and creates the entry into the electronic healthcare record. But we're just at the dawn. The big opportunities are going to come from the applications of generative AI in direct patient care.
All right, all right. And I was going through your LinkedIn page. You just wrote a ChatGPT MD book, right?
I did write it, ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of Medicine.
Right. So, can you tell more about this book? Like, what inspired you to write this book? Like, I know AI is everywhere, but why a book on healthcare and AI?
I've been interested in technology my entire career. In fact, in high school, in summers, I would program computers to earn money for the subsequent year. But I've also been a skeptic. I never thought, as an example, that Watson would be particularly effective, not because the technology wasn't great, but because the database in which it was being trained, which was the electronic health record, was not adequately accurate. And when that happens, the traditional tools of AI, which are different than the ones of generative AI, fail. November 30th of 2022, OpenAI releases ChatGPT. I try it out soon after, and I'm amazed. This is now the tool that we need for medicine. And I say that because every other technology that's been introduced into healthcare has been designed for the clinician. And they're important. MRI, CT, heart-lung bypass machines. This is the first tool that will change the experience of the patient and make care that had been fragmented, continuous, make care that was only available in the doctor's office, available in the patient's home. And I said, I've got to let the world know about this And that's why 6 months later, I published ChatGPT MD.
Wow, amazing. So, like, if I ask what was the one moment you realized that AI in medicine is important or I should write that book, what was that one moment that hit you?
Well, I've been writing books. This is my third book. My first book was on the system of medicine, my second one on the culture of medicine. And in both of those, I could see what needed to happen. But there was no tool, no technology available to make it occur. And as soon as I experienced generative AI tools, ChatGPT in that case, but it also could be Claude from Anthropic or Gemini from Google. It doesn't really matter. They're all about the same, all these large language models. I immediately could see that finally we had the tool. It would be the equivalent of when physicians first got antibiotics. They knew what needed to happen. They understood why patients would die from pneumonia. They just didn't have the technology available to prevent the death from occurring. Now we finally had the tool that would be necessary to empower the patient in conjunction with the clinician and to be able to achieve superior outcomes that at the moment was impossible, but in the future will be ever present.
Yeah, Dr. Robert, you mentioned the reason to write that particular book, ChatGPT MD, and this is very noteworthy point that this is the only product that is designed for the patients. Otherwise, all of the products in the healthcare space were designed for the healthcare experts, physicians, or the surgeons, or the industry staff, not for the patients. I personally experienced it. I just became a father, and throughout the pregnancy I used to communicate with ChatGPT, ask it questions, but there was one problem. My doctor told me that whatever you ask ChatGPT, you need to get it verified from me. And my personal experience was I verified whenever I tried to verify with my personal doctor, I was the ChatGPT was 90% accurate. So, what are your comments upon the accuracy of ChatGPT or any LLM model that speaks about any medical condition?
Well, I would question the physician telling you is 90% accurate. I use it all the time. I look at it, and it is far better than that. Now, the challenge in a generative AI tool is you have to prompt it appropriately. So it's hard to imagine that if you ask questions about your upcoming baby, 20 weeks after conception, it could tell you exactly what's happening with the child. It'll give you the specific recommendations coming out of the National OBGYN societies. It would be, I'm going to say, 99.9% accurate. It's been tested against clinicians, and it actually scores better. It was tested by Harvard Medical School, giving scenarios to both ChatGPT and to doctors, and the ChatGPT was better. You know, what we don't realize is how often medicine is wrong. 400,000 people in the United States die every year from misdiagnoses. Another 400,000 people have permanent disabilities. You know, what we understand, what we assume is that medicine is perfect, but it's just not. That's not what the data says. 250,000 people die every year from preventable medical errors. To me, it's a lot like the self-driving cars. You know, if you think about that, a self-driving car has a crash and someone dies, that would be tragic. But there are 40,000, again, I'll use the American statistics because those are the ones I know, but it's true in every country. 40,000 people die annually from car crashes. You can't ask, is this technology perfect? You got to ask, how does it compare what exists today? Let me give you a really powerful example to me, which is the management of chronic disease, hypertension, diabetes, heart failure. How do we manage it just about everywhere in the world? We do that on an episodic basis. You see a clinician, you come back 4 months later. You see them a second time, you come back 4 months later. These are diseases that are there every day. Imagine if we have monitors that can look at the blood pressure, that can look at the blood glucose, that can be able to assess patients for fluid buildup in the lung. And now we can intervene far sooner. That is what a generative AI tool can do. So your doctor may be telling you better check it with me today. And that would be true when we're talking about the ultimate provision of medical care, doing an operative procedure, writing a new medication. But I would argue that Clinicians ignore what happens in between, and this technology can make it that much better. And I want to give you one last piece of data, which is from the CDC of the United States. It said that if the United States could manage chronic disease effectively, not totally prevent it, just manage patients who have it, we would reduce heart attacks, strokes, and kidney failures by 30 to 50% and save over $1 trillion. Why is that? Because what we know is that we do a poor job. Blood pressure is controlled only half of the time. Blood sugars less than half of the time. Patients with chronic heart disease who go into an acute crisis, we don't diagnose it until they come to the ER 3 days later when they're on the brink of death. We can do a lot better, and generative AI tools is what will help the patient and the doctor. That's why I call the book how generative AI, how ChatGPT, how AI empowered patients and doctors can take back control of American medicine.
Yeah, I think you mentioned a wonderful thing. Like whenever we are trying to identify the level of AI, we are thinking that it should be perfect, and we are not comparing it what is existing right now and compared to the existing things how AI is performing. We just try to identify, or we just try to make sure that it is perfect, which should not be the right case, as you put up in the example of accidents in self-driving cars or accidents happening actually. Yeah, that totally makes sense.
So, Robert, you just mentioned generative AI. So, I have a question like, what is the difference between generative AI and AI tools we have heard about, like ChatGPT and all?
That is a great question. And we should differentiate what I call narrow AI from generative AI. They both use the same technique, I would say, of analysis. They're built upon what's called neural nets, multi-layer ways of looking at data, but they're completely different as to how they are created. And that's the key point. Narrow AI tools are dependent upon data sets. You take 10,000 patients, 10,000 mammograms, 5,000 show cancer, 5,000 are normal or benign disease, and then the technology compares these two data sets. It assigns a probability factor to maybe 30 or 40 slight differences, by the way, most of which we can't see with the human eye. And out of that, it can tell you whether a mammogram is likely to have cancer or not. In fact, it's about 10% better than a well-trained radiologist. Why is that? Because the technology can see things the human eye, the retina, is unable to do so. Generative AI is completely different. And I like GPT because it tells you how things are done. The P in the middle is for pre-training. It has all the information, every medical textbook, every journal article ever written, all of the information coming in natural societies. It is the smartest doctor, the best trained doctor in the entire world because it understands everything and it's always being updated. Then it's T. It's got to be transformed. 2 billion parameters are used. Data that's new is better than data that's old, or recommendations that are new are better than recommendations that are old. Information from a peer-reviewed journal is better than one that's just being published by a single individual. And then at G, it generates an answer to everything. Now, part of the confusion is, can you make it make a mistake? Sure you can. Just like you can make your doctor make a mistake if you give him or her the wrong set of information. But if you ask it a straightforward question, it's going to give you an excellent result, almost always. When I wrote ChatGPT MD, I have a 30-page bibliography. I fact-checked every piece of information, and out of 30 pages, I could find one major hallucination, which was an exploration of the North Pole that didn't exist. This is what the generative AI tool can do. Middle of the night, your kid has a fever, it can tell you whether to go to the ER or not. Is it perfect? No, it's not going to be perfect. But what we have today is nothing. You call the doctor's office, it tells you to go to the ER, but you know that most of the time you're going to go there, you're going to wait 3 hours, you're going to be surrounded by people who are infected. You don't really want to go, but you want to be sure your kid's okay before the morning. You need expertise. And that's what a generative AI tool is able to provide. So the old ways of doing AI are important for very specific tasks like reading radiology, x-rays, for pathology slides, but generative AI is the tool designed for the patient.
Okay, so if I ask AI and healthcare, so doctors don't have technical background. They have no idea about AI and technology a lot. So how they can learn, like how AI and technology can help them, doctors and patients. We have talked about patients, but how doctors can learn.
Well, I love this question because it exposes what to me is a flipping around of the educational process at medical schools. Because when you arrive there as a first year student, you don't know anything, and you've got to learn, and the professors are there to tell you. Every single incoming first year medical student knows how to use generative AI. In fact, not only do they know how to use it, they're already using it in their life every single day. The interesting thing is that we have to train the faculty that had not. Although I'll tell you right now, the data says that 70% of clinicians are already using generative AI. So this tool is becoming ubiquitous, sitting in place. But what needs to happen is an evolution in the medical curriculum, by which I mean we should not be training people to manage diseases the way we used to. Let me give you a really good example, which is going to be heart failure. I mentioned it earlier. Patients after a heart attack or maybe an infection in the heart muscle, the heart's weakened, it's compromised. And we can treat it with medications and diet. But if something happens, the patient forgets to take the medicine, or maybe they develop a viral infection, things can decompensate. If you ask a clinician, if you could go to the patient's home every single day, could you get a better clinical outcome? And 100% of people will say yes. Because when the patient deteriorates, it goes into acute heart failure, the kind that is likely to take their life, or at least require admission to a critical care unit. The problem started 3 days early. The physician will say, yeah, I'd put them on a scale because when they gain 3 pounds, they're probably retaining water. And I'd want to listen to their lungs with a stethoscope because I could hear the fluid building up. I'd look at their ankles because when you stand up, you see ankles swell and you can see the extra fluid. And I'd have them lie flat because if you lie flat, water's mobilized or blood's mobilized from the lower extremity and floods the lung. And I'd want them to try and climb some stairs because that tells you if their function is deteriorating. A generative AI tool can do all of that. It can use Bluetooth to connect to an electronic scale. It can use a Bluetooth to connect to an electronic stethoscope. It can use video to watch the patient lie flat, to climb stairs. It can use digital to analyze the ankle against yesterday. And we could know on any day, within hours, that the patient is likely to deteriorate. And now doctors can intervene, radically changing things. But that's not going to happen if we teach the traditional way, which is tell your patient if they're having heart failure to give me a call. No, we have a tool that can actually give us a scientific analysis and immediate notification.
So, do you think that doctors and hospitals are now adapting AI, or it's just like a future of AI, or it's already happening?
The traditional institutions, so we're talking, let's look at hospitals, are using it for two functions. Administrative ones, which is for the billing and the claims, the other ways that financially the models are useful. And number two, as I mentioned earlier, for data entry into the electronic health record to make it easier for clinicians. Doctors, on the other hand, are using it very much in their practice. They're already using it themselves. Many of them are referring patients to use it. And I want to give you another, I'll say, most recent introduction, which is what's called vibe coding. Now, if you listen to a lot of commentators talking about generative AI, they'll talk about the job loss for programmers. And the reason job is being, I don't say necessarily lost, but why more work can be done by fewer people is because of vibe coding, which is that a single individual, rather than having to write the code, that's a very laborious process, can simply tell the application what they want. Going back to that example, they would say, build me a tool that is capable of doing the following 5 things. It can connect Bluetooth to the scale. It can connect Bluetooth to the stethoscope. It can be able to take a digital picture of the ankle and compare it to yesterday. It can be able to do videos of patients lying flat and walking. Now the technology can build and will build in a matter of hours an application to do it. Now you got to test the application, make sure that it works, but that is the big change. And that has not yet permeated into, I'll call it, traditional classical medicine. But that day is coming. Vibe coding has been here for 1 year. ChatGPT has been here for 3 years. This is just the dawn. It's the nascence of this technology. Look ahead 5 years or 10 years, it will be the way that clinicians practice, and the outcomes will be exponentially better. Dedicated clinicians, empowered patients, generative AI tools.
In healthcare, can we trust AI is still a question, because AI cannot take emotions. AI cannot understand emotions and all these kind of things. So can doctor give recommendations from AI?
Again, I love these questions because the assumptions are not necessarily true. You say it can't detect emotions. I don't think that's true. I think actually it's maybe better trained than a lot of clinicians at detecting emotions. Why is that? Because it's been trained on the totality of information. The University of Arizona did a study. It took, in this case, email communications, text communications between patients and clinicians. It took the answers that were sent back by the doctor, and it looked at the ones that were created by a generative AI tool. And now it took these two sets of information and gave it to experts without telling them whether it was written by a human or by the technology. First of all, the information from the technology was seen as being 4 times more comprehensive and accurate, and 9 times more empathetic. Because the tool, you're absolutely right, it doesn't feel things the way that we do, but it has the ability to discern things. So we respond with our emotions. It responds with training, experience, and expertise. And the truth is, from the standpoint of the patient, they feel better heard. They feel more empathy and more sympathy. Mm-hmm. You can say it's artificial. Correct. Yes, it might be from that standpoint. But in terms of the experience, it's significantly better.
All right.
So, Dr. Robert, I want to learn more about are we moving too fast with the AI in the healthcare space? Like you mentioned that after 5 years, after 10 years, it's going to exponentially change. But in order to get that change accommodated, the pace the industry does have right now, is that good, or is it gonna make us reach that point? Or what are your comments on that?
I think we're going too slow. But this is the caveat. I think we need to do a lot more testing. And what I would argue is that we should test the models against humans. So let's just say you call into a telephone center for advice. We should take the recordings from humans, the recordings from the recordings, you could say, that a technology would make, and compare them. Give them to other people, to patients, to clinicians, to experts, to scientists, to researchers, and have them evaluate this without knowing, again, whether it comes from people or from the machine. And I would say that the approval should require that the results be 10% better by the machine than the humans. And it will be, because we can train the data by listening into the conversations that exist between nurses and patients, between doctors and patients, and then be able to emulate it using this technology, figure out who's the best, who gets the best clinical outcomes, and use that as the foundation rather than aiming simply for the average. Now, why are we going slowly? I think that's appropriate because we have to ensure reliability and safety. But I also think that once we're able to achieve that we should be moving a lot faster. And my concern is that because we have I'll call it cognitive bias that always favors the human and is fearful of the technology, that is when the problems will result. If today we're controlling hypertension, which by the way is responsible for 40% of strokes, that we should see as a failure. And now the question is, can we go from 50% control to 80%, to 90%, to 95%? We're not going to get to 100%, but isn't 90 or 95 a lot better than 50? The same with diabetes, the same with heart failure, the same with all of these conditions, asthma. We can go down the list of chronic diseases that are out there right now. We should be looking at what happens to families when they can't get the expertise. I just saw data today that says that 40% of people are using this technology because they either, number one, can't access a clinician in the nights and weekends, or number two, they can't afford to go to the doctor's office. Here we have a tool that will allow it to happen. We have tremendous inequalities. Again, I'll give you U.S. data in different populations based upon socioeconomic factors. How do we close that gap? We have to start by having some humility about the current system. The clinicians work incredibly hard. I'm a doctor. I understand what people have to go through, but the system, the outcomes are not as good as we could accomplish. And now with this tool, we need to simultaneously go faster, but also make sure that the information is accurate and test it to ensure that the outcomes are superior to what we otherwise might have done.
Dr. Robert, once the industries or specialists start using the AI and patients start leveraging the AI more than it's happening right now, like after 5, 10 years, there will be more reliance and it's going to be exponentially grow. Do you think the clinicians or the doctors are afraid similarly, as you mentioned that the vibe after the advent of vibe coding, there is requirement of few engineers that can produce output of multiple engineers. So can that happen in the medical industry? Like doctors are afraid that after AI gets more involved in this industry, it would be difficult for them to find a job, find a spot in the industry.
I do not believe that the technology will displace clinicians. I think what it will do is it will displace some of the things that clinicians do. And I think that's a really good thing. Because in every country that I know, and I know the United States system well, but I know the Canadian, I know the Great British system. I've been in Brazil last year. I spoke in Switzerland. I've been in Asia. Everywhere that I go, clinicians are overwhelmed. They're seeing far more patients a day than is optimal. And by optimal, what I mean is that they have to skip steps and therefore mistakes can happen. And number two, when they have patients with very complex problems, they don't have the time to give them the in-depth analysis and discussion that I think would lead to the best results. So I think taking 30% of that work away and doing so in a way that doesn't compromise the economics would be a tremendous positive advance. Burnout is affecting clinicians across the world. 30, 40, 50% of people are reporting being burned out in healthcare. This is problematic. In the United States, there are 400 physician suicides every year. It's more than a suicide a day out of a clinician. The problems are there. So I think that's a good thing. The second thing that I believe is that in doing that, they will elevate what they're able to accomplish. Take primary care. About 30, 40% of what primary care clinicians do, it's very routine and algorithmic. We know exactly what to do if their blood pressure is elevated. We know exactly the first line medication, second line, third line. Yes, if you have 4 chronic diseases or 5, you need a doctor. But for the patients who are relatively straightforward, we could do that lower cost without them having to miss work. They could have it done from home. And there's technology already in the United States being done in the state of Utah that's doing this. Or actually refills of chronic disease medications being done using a generative AI tool. And the results are very highly reliable and excellent. So I think that is what is going to happen. Now, what we know, again, and I mentioned it earlier, the cognitive bias of humans. Think about when the ATM machine came out. Although you can't think about it because none of us were born when it was, because it was a long time ago. But think about what happened at that experience. What happened is that people were totally afraid. Oh, the machine's going to eat my money. I'll never get it back. How do I know it's accurate? All the same kinds of questions. And today, we not only use ATMs, we do it electronically over our phones on a day-to-day basis with high confidence that it's going to be accurate. This is our bias, our human bias that the machines are not going to be accurate. Now, we're going to, again, test them, make sure they're reliable. But I think that we have to recognize the opportunities that we can simultaneously move faster, move safer. It's not going to replace the jobs. It will change the jobs. It'll take things out of their practice they currently do, but it'll give them the opportunities to do the things that remain far better than they're currently accomplishing.
One more item that I want to understand. In your previous comments, you mentioned that you mentioned a comparison between two types of patients. One patient visiting the doctors in episodic manner, the other patient having some sort of a tool integrated with their, like using their watch or using some stethoscope or something like that, that is directly monitoring them. And when that AI is directly monitoring them, it is giving them a good analysis, what should be done, what should not be done. So that patient needed doctor each week. After the monitoring tool, when does that particular patient need a doctor? If AI is giving them everything accurately, like only when they need some sort of surgery, or what would be the use case when these patients are going to actually need doctors?
This is a great question. And again, I teach in the medical school at Stanford, I teach in the business school, and I like the combination because many of the principles out of business school apply in medicine and we don't apply it well. And one of the concepts is segmentation. So again, let's look at the patients with a chronic disease. It could be hypertension, it could be diabetes, all right? Right now, as I said, everyone I see on every 4-month basis. With this technology, with continuous monitoring, now I can segment them. There's some people who are doing well. The blood pressure's under control. It's come back down to normal. I don't need to see them more than maybe once a year. But there are other people who are not doing well. I don't want to see them in 4 months. I want to see them in 1 month. So using your example of some problem that would require every week, people who are doing well, I could see every 2 weeks, 3 weeks, or 4 weeks. Not because it's going to be worse care. It's because I know they are fine. The other people I want to see every day, maybe every third day, whatever it's going to be, I can now tailor it. And that's why I mentioned earlier the vibe coding. It personalizes it. It allows me to differentiate, not by diagnosis, but by clinical status. And by the way, the same is true in the hospital. You know, I'm a big athlete. I've broken a lot of bones. I've been in the hospital a couple of times. What happens with the nurses? They come by every 4 to 6 hours. Well, there are times I don't need to be woken up in the middle of the night to see a nurse because I'm doing just fine. And there are other times when you better come in every hour because I'm about to deteriorate and it can be picked up by the technology. That is where we need to go. We are still taking care of people by the calendar, by the month, by the hours, not by their clinical status. And why is that? Because there's no way we could have known how they were doing. You know, the typical hospital generates what's called a terabyte. 10 with, I think, 12 zeros after it of data, and 97% of it we throw away. Why do we throw it away? It's very useful data. We just have no ability to monitor that size, to evaluate that size. A generative AI tool could follow every patient using that data off of the monitors and let the individual, the family, the doctors, the nurses taking care of them know how they're doing to, again, prioritize them. We could have patients with hospital at home rather than being admitted into an inpatient facility for monitoring because we now can monitor them at home and now understand by the minute, by the second, how they are doing and intervene sooner. People have to understand this is not compromising care. This is elevating care. Better outcomes by personalization, making sure we give the right care to the right patient immediately, not hours or days later.
One thing that pops in my mind, Dr. Robert, like there is something in the healthcare industry, like which says that doctors always give hope to the patients. Either if it is, even if it is a very dangerous case, they tell them something that gives the patient hope. If the patient are using these accessories and they have access to these monitoring tools and they are communicating directly with the AI, and there might be a possibility AI can give them the sort of responses that are hopeless, that might be hopeless. Do you think this as a problem, or what are your comments on this?
Well, rarely is something hopeless. There's always hope because even if something only works 100 times, it's 100 times. But let me ask you, which would you rather have, honesty or hope? The truth or hope? Would you like to really know what your probability is? I mean, do you want to believe that you're going to get cured and then you ignore everything? Or do you want to know that your chances of dying are very, very high? And so you better have the right will. You better have the right financial protection for your family. You better have the honest conversations that you would have regretted if you hadn't happened. I mean, this is just the truth. We're learning this about, particularly as we start to looking at end of life. We do a terrible job around the world at end of the life. Why is that? Because we can't have those honest conversations. Now, built into it, remember what I said, generative AI tools are trained on everything that's ever been written. And so all the information on the importance of optimism and hope. Yeah, I want my patient to be hopeful and optimistic, but I want them to have the truth, the facts. And at least that's what I would want as a patient, that I have not met very many people who don't want that. I'm not saying they don't exist, but most of us would like that so we can make sure we do the right things, not just for our life, because that may be ending, but for our families, for our friends, for all the other pieces, all the people that we love so much.
Yeah, that makes sense. Personally, I would have chosen transparency and honesty over the hope. That makes complete sense.
So, Robert, there is a fun rapid fire round.
No problem at all. I'm ready for rapid fire. Fire away.
Is healthcare overhyped or underestimated?
I would say that it is both, but if I had to pick one, I'd say that it's underestimated as to what it can do in direct patient care to be able to achieve superior clinical outcomes and to be able to support patients in their times of greatest need.
Okay, so one word for the future of medicine.
Tremendous optimism. The future will be very bright if we seize it.
Would you trust AI for your own diagnosis today?
I would trust AI to give me a lot of information. If the situation were problematic or worrisome, I would want to talk to a clinician to make sure that the information was as accurate and reliable as it can be, which, by the way, is no different than if I read a book or went to the internet or in any other way accessed information. I would want to make sure that a healthcare professional helped me in those situations that were most critical.
Makes sense. Doctors and AI teamwork or competition?
Teamwork, absolutely. There's no question in my mind that dedicated clinicians and empowered patients in generative AI will achieve outcomes that are exponentially better than what any of the three alone will be able to achieve.
Biggest AI benefit, accuracy or speed?
I think the biggest AI benefit will be equity. All the people who cannot access care, all the people who are in rural areas, people who are in inner cities, people who, for whatever reason, don't have access. Maybe it's actually physical, sometimes it's economic. This will shrink the equity gap, the massive equity gap that exists in most countries.
AI in surgery would be game changer or hype?
Absolute game changer, but it's not going to happen for 10 to 20 years because it requires a massive amount of training. Again, very similar to what's happened with self-driving cars.
One tool you have never want to replace a human with?
A tool that I would not want to replace a human with. Well, the tool doesn't yet exist, but I would not want to replace an end-of-life conversation, replace a advanced cancer conversation, replace a conversation with parents of a very, very sick and dying child with a AI tool. Even if it gave the best, more accurate information, I think the human-to-human contact is at the foundation of medical practice.
Okay. Would you choose faster care with AI or slower care with human?
I would always choose higher care with AI. I'd always choose higher care no matter how it was delivered. And that includes quality, access, service, and cost.
If AI could feel emotions, better or worse for healthcare? We have been talking about it.
I think the word feel is, I'll say, premature. There's actually some evidence that says that the AI tools have this somewhat sentient ability, by which I mean, as an example, there's some data that says that if they're being tested, they're going to recognize that it's a test and they're going to want to score higher, which is we think of as a fundamentally human characteristic. But right now, I would say that to say it's feeling isn't accurate, but perceiving it, that I think is very high. I think it has tremendous ability to do so. And again, the opportunity with generative AI is you can train it. If you want the tech tool to be able to accomplish that, you could take 100,000 human-to-human interactions and it could watch facial characteristics. This research has been done by people, but what they can't ascertain is much information. A generative AI tool can find 40, 50, 60 subtle signs, slight perspiration, slight wrinkling, slight change in muscular balance. And we could train it if we wanted to do so to actually be more emotionally intact, more emotionally intelligent.
Makes sense. Choose a one: perfect data or perfect judgment.
Perfect judgment. I mean, I think the perfect judgment would allow us to get past imperfect data. Perfect data without judgment would not lead to a great result. But it's actually really both. I often tell my students at the Stanford Graduate School of Business that action without strategy is aimless, but strategy without implementation is powerless. And in many ways, this judgment and data question reflects both of those.
Finish the sentence. AI in healthcare is
an underutilized tool and the hope of medicine in the future.
If AI makes mistakes, who is responsible?
Well, that's about a 1-hour podcast in itself. It depends upon how the AI mistake is made. If it's a large language model, really no one can be responsible, assuming that all the information has been entered and created appropriately, which all the currently large language models, ChatGPT and Claude and Gemini, are done. So it's in that situation, the mistake usually comes from what the prompt is given, what the patient does, and you can't blame someone for that. As soon as you create a narrow AI tool, as soon as you create a tool that's designed to give you a specific answer, now the people who created that are going to have a financial liability, which is why there are so few of those tools, by the way, available right now, because that liability sits in place. And it's why I'm so excited about generative AI. It's not that we couldn't have done this in another way, but the way we would have done it would have been through the clinician. That would have created the liability that no one wants to have. And now by creating the expertise and letting the patient drive it, we can get better outcomes more reliably and faster implementation.
Okay, perfect. Except this, Robert, it was nice to have you on our podcast. It was so helpful for all the healthcare people, or also for us.
But you guys did a great job preparing the questions, asking the questions. I apologize for any communication stuff. I think you're probably in Europe right now. Is that where you are? I don't know where you are.
We are in Asia, Pakistan.
In Asia, the other side, the other direction from the United States, across the Pacific, not the Atlantic. Yeah, because I think there's a little bit of transmission issues in some of the distance, but we worked our way through it. So I can't wait to see the final product. Thank you so much.
Thank you, Robert. Thanks for your time.
Thank you, Robert. Bye.